This is pharmaphorum web editor Nicole Raleigh, and I am on site at ESMO 2024 in Barcelona. And I have with me Dr Magda Meissner, who is consultant medical oncologist at the Velindre Cancer Centre and project lead for QuicDNA. Today we will be discussing how a simple blood draw can transform clinical practice in oncology. Welcome, Magda. So to begin with, perhaps for viewers, you could take us through your journey to doing what you do and explain the passion that drove you.
So as a medical oncologist, I always have that passion for research, and I did my PhD in liquid biopsies in circulating tumour DNA a few years ago in actually breast cancer. So I've got my experience and expertise in ctDNA in breast cancer already. And as I've progressed in my training in medical oncology, I was able to then use my expertise to introduce liquid biopsies in other cancers. And the perfect cancer was, at that point, was lung cancer, because lung cancer have poorly outcomes, but at the same time have the significant development in biomarkers, genomic biomarkers, and multiple targeted therapies being developed for lung cancer in first-line settings. Therefore, it was a need to improve diagnostic pathways. It was a need to improve tissue testing for biomarkers, as they can take a long time by the time patient gets to receive their results. So we were trying to actually improve these outcomes with introducing liquid biopsies, where we can test patients very early in diagnostic pathway, very early in when they have even suspicion of cancer, from the simple scan, CT scan, and they have a blood draw at the same time. Even before they have a tissue biopsy, they can be profiled via genomic testing and provide the results of biomarkers. As soon as they get pathology results and the final diagnosis, biomarker results is there with them, and they can start treatment as quickly as possible as well, because it's an oral therapy for most of the time for the targeted treatments, so the treatment can be started very quickly.
Yes, it's amazing. Your passion for it is clear, and it's exciting, this development. So if we discuss, molecular profiling of tumours, it really is crucial for optimising, as you say, the cancer treatment in clinical practice. And one innovative method, which you mentioned then, ctDNA, or for our viewers, circulating tumour DNA, comes from these blood samples, and it's on the cusp of becoming so much more a standard approach, as it were, in managing patients with advanced cancer. Is there more to know about this? Obviously, there's more to know about it, but do you want to expand slightly?
So the liquid biopsy, the circulating tumour DNA, is a DNA that most tumour sheds to the bloodstream. And we can, by taking blood sample, we can extract that in the lab, that fragments of the DNA, and we can provide similar profiling we do for tissue biopsies. And it's from that use of the liquid biopsy, it doesn't have to be only in diagnostic pathway, but will be very relevant for other tumor types in any other settings. And we're using for disease monitoring, for when disease progress, in treatments for different type of cancers. And also it also will be, and there's already ongoing studies introducing and informing us, even for patients with early stage disease, then when we will have to employ neoadjuvant treatment or adjuvant treatments in future. So the ctDNA role will have a place in multiple different settings for different tumor types in future.
Great potential, yeah. So Illumina's ESMO workshop looked at liquid biopsy-based biomarkers for cancer profiling and monitoring, both current and future applications. And this is your area of expertise, isn't it? So you're working with the QuicDNA collaborative in liquid biomarkers. What more can you tell us about?
So the QuicDNA study is a study we employ in Wales. Now all health boards in Wales can provide liquid biopsy to patients with suspected stage 3, stage 4 lung cancer. And those patients can be then profiled via blood test. And we already have patients who've been receiving treatment earlier than they normally would do. And for some patients, it's a game changer, because sometimes the challenges we have with tissue biopsies, like taking the biopsy for lung cancer, can be tricky and difficult sometimes and associated with complications. But actually also when patients then have the tissue biopsy, not always there is enough material to perform genomic profiling. So some patients have no genomic profiling, so liquid biopsy is sometimes the only opportunity they can have to be tested. So QuicDNA offers patients that test very early in the pathway so they don't lose that opportunity.
Again, amazing, exciting. So it's more about sort of precision medicine, precision oncology. So providing this comprehensive, this non-invasive, this, as you said earlier, rapid method, identifying clinically relevant biomarkers. More widely in the precision oncology space, how is this transforming things?
So, there's multiple studies. Our QuicDNA study is one of the studies that we're trying to prove and show that the liquid biopsy can be actually already implemented to standard of care practice. We are very close to introducing and using on daily basis.
Yeah, I mean, it's broadening out. We're hearing throughout the conference.
That's right, yes.
Multiple different conversations around this topic. So if we think about the conference now, about ESMO, we're here in Barcelona. Have there been any sort of key takeaways, insights, thoughts that are perhaps changing how that future hope for the oncological space works?
So now that we've got third day of ESMO, I've been going to different sessions, and as my interest is not only in lung cancer but also other tumor types. And whenever I go to the session, actually ctDNA seems to be mentioned most all the time. So I think now it's almost becoming a norm, and also still using in studies in some places, but actually we're using more and more in clinical practice. And we're hoping with the QuicDNA that we'll probably be able to implement into standard of care practice next year.
Amazing.
Yeah.
Again, amazing. Thank you very much. It's been a pleasure speaking with you, Magda.
Thank you.